Periodontist, we focus on the foundation of the teeth. We do evaluate teeth, but we're looking at the bone and the soft tissues. So anything that involves the teeth is where we work. Gum grafts, if somebody has recession, we can replace missing teeth with dental implants. We can do laser surgery around teeth if they have periodontitis or bone loss. There's anything that deals with the hard and the soft tissues of the teeth is what we do. We don't actually work on the teeth themselves. It's a very, very different concept compared to general dentistry. Primary goal would always be function and health. The aesthetics is the fun side, meaning anybody wants to make a smile look better. So that's the fun side. But the primary goal of periodontics, for me, at least in my opinion, in my practice, would be health and function first and foremost. It doesn't matter how pretty the teeth are if the bone and the foundation isn't healthy around them. Our primary focus from the aesthetic standpoint, let's say you need a crown on a front tooth, but maybe you have a little bit of recession. We can actually do sort of a gum transplant from you to recreate the anatomy that you've lost from disease or trauma over time. Aesthetics are a big thing because everybody wants to look better, but we also focus on the disease model. They've shown over time that heart disease, risk of stroke, diabetes can all be affected in the mouth, and the mouth can affect those disease parameters. So however we can make your mouth healthier is what our primary goal is going to be, especially if you have teeth that we want to help you maintain. A lot of people do dental implants. We do also do dental implants, but our main focus is trying to preserve what you have in order to help you maintain health and function as long as possible. In dental school, we all get a very well-rounded, basic, general education in dentistry. In order to go into periodontics, I did an additional 3 years of training on top of the 4 years of college and on top of the 4 years in dental school. So it was another 3 years. And then I had another residency in there as well. So, and basically K through 12 all over again. You know, it wasn't work. You're learning every day, and it's not just textbook. You're chairside, hands-on. You're practicing and doing what you're reading about. So it's not just all book work. It was very hands-on learning. You have to apply what you're studying about. And so for me, it really wasn't school. It didn't seem like school. I always wanted to be a surgeon, and my dad didn't think that I wanted to have the hours of being on call 24/7 like a medical doctor would. And so he encouraged me to go in for dentistry, and I went and observed, and within a couple hours I knew that that's what I wanted to do because of the hand skills. It was very neat and it's artistic, and it's detail oriented. And in dental school, perio was just sort of natural. I didn't have to struggle with it like I did some of the other specialties. For me, I just got it. It just made sense. So I always wanted to be a surgeon. I just didn't know it was going to be in the mouth. I grew up in western Kansas and started skiing when I was 5 years old. We had wanted to go back to Texas, but 9/11 had happened and the markets had crashed, so there wasn't much opportunity in Texas. And so January of '02, our last year of residency, about 12 of us came out for a ski trip. I said, yeah, I think I can make this work. I call Colorado the world's largest adult playground. Anything you want to do out here, you can. Biologics, or what they've learned in laboratories and with growth factors, how we can help your body heal itself by enhancing, contributing factors to speeding up healing. The materials that we have available now weren't even available 10 years ago. So there's a chance for enhanced healing with more conservative surgical techniques. We now have lasers in dentistry that are becoming mainstream and sort of standard of care. So instead of having to cut and sew, we don't have to do that anymore. That's always an option, but we can be more conservative. We don't have to remove as much of your natural tissue. We can help your body heal itself sort of from the inside out with laser energy, and we've never had that mainstream. It's never really been affordable to any of us before, so now we've been able to incorporate that into our practice as well. As a specialist, we get referred patients. I would say number one is usually personality of the patient to fit the care provider, because not all personalities match. So Care, I think the general dentist should be aware of the quality of care that we can provide for patients. The patient's not going to know specifically, but our referrals, that's why we work with our referrals to let them know what we can do for patients, how we try to interact with the referral or the general dentist, because we can't just take care of the patient. We still have to have a quarterback for the team, and that's where our general dentist comes into play. Patients will know from how we try to take care of them from the minute they hit the door, whether it's personality, a warm greeting, treating them like I would want to be treated. Communication is key. It's always nice to have introduction from the general dentist, so we're just not meeting a patient blind. What are the patient's needs? What's their history? Is this an emergency type situation? Have they been under that general dentist provider's care for maybe the past 10, 15 years and they've started to notice some situations? How much does the general dentist do themselves? Have they tried to maybe address the periodontal issues and they've been unsuccessful, or maybe didn't achieve the results that they wanted and they need additional specialty care? That information is paramount, so we know what we're starting with. Patients, I always try to respect their time because they have a life outside our office. So the more communication that can go on ahead of time before they get there only will help sort of speed up and streamline the care that we can provide for a patient. So communication is key. The biggest challenge with periodontal disease as a specialist, people are pain motivated. So if they've got a toothache or if they've broken a tooth or they're in pain, that's a great reason to go to a dentist. But periodontal disease is sort of like heart disease. It doesn't hurt. It's sort of a silent disease. A patient who hasn't been to a dentist for years might notice teeth drifting, shifting, spaces where they didn't used to have spaces. Maybe their teeth look longer than what they used to. Sometimes gums will bleed. Sometimes a loved one or a spouse or friend might complain of bad breath because of the bacteria buildup. Those would be indications, especially the bleeding gums when you brush your teeth. If you notice any pink in the sink, that's not healthy, that's not normal. There has to be an underlying cause for it. I think in general, people are so fearful of dentistry because they think it's going to be this painful situation. And with anesthetics today and careful technique, it's almost microsurgical or plastic surgery. It doesn't have to be gruesome. It can be very not comfortable. Surgery is never comfortable, but the outcomes and post-operatively can be so minimal compared to what most patients think it's going to be about, especially with soft tissue grafts. We have ways to make it very, very comfortable, and the outcomes are just amazing. Aesthetically, to be able to give a patient back a smile or to be able to improve something that they've been aware of, maybe self-conscious about, to be able to improve that for self-esteem is just huge.